Do parents have the right to know about their teen's intimate life? Are teens entitled to privacy when it comes to procuring contraceptives? These are a few questions that are important to ask ourselves when it comes to teens and contraception. While having a conversation with our children about safe sex and using contraceptives may not be a comfortable one, it's an important one. Today I'm going to talk about why I believe that teens are entitled to privacy when it comes to getting contraceptives. According to Psychology Today, currently federal laws state that teens do have the right to obtain and use birth control products without a parent's permission. These laws are being threatened constantly by lawmakers trying to propose new guidelines that would place barriers on teen access to contraception. These proposed new laws would lead to dangerous outcomes of the health and welfare of young women while increasing their risk of unplanned pregnancies. The cost to society from teen pregnancies are enormous. Teens have constitutional rights to privacy that supports their decision to obtain contraception, a right that lawmakers should respect and acknowledge. According to the American Civil Liberties Union, studies show that preventing teens from getting contraceptives unless they tell a parent won't stop them from having sex. It will, however, drive them away from the services that they need to protect themselves, which in turn leads to higher rates of teen pregnancies and sexually transmitted diseases, including HIV. As parents, we would love to think that our children are smart and would practice safe sex, but if we are not allowing them that right, we must acknowledge that they are going to do it anyways. Wouldn't you rather have your child safe than force them to get your consent for contraceptives? Some people say that allowing teens to get birth control encourages them to be sexually active and that requiring them to tell their parents before getting birth control would actually discourage sexual activity. This is just not the truth. Teenagers don't become sexually active just because they can go to a family planning provider and get contraceptives in confidence. The Journal of American Medical Association looked at what sexually active teenage girls seeking services at family planning clinics in Wisconsin would do if they couldn't get prescription contraceptives without their parents' consent. I think the results are pretty important. The results showed that 47% of sexually active teenage girls said that they would stop accessing all reproductive healthcare services if they had to tell their parents. This includes stopping all testing and treatments for STDs, including HIV. Another 12% would stop using some of the reproductive healthcare services or would delay testing or treatment of STDs. This means that 59% of sexually active teens would stop or delay getting healthcare services. The most important part of this study is that even though 59% would stop using the services, 99% said that they would continue to have sex. There's a reason that the leading medical organizations, including the American Medical Association, the American Academy of Pediatrics, the American Academy of Family Physicians, the American College of Obstetricians and Gynecologists, the American Public Health Association, and the Society for Adolescent Medicine, among others, oppose laws that would require teens to involve a parent when obtaining contraception. These organizations know that this is not the answer, and it would in fact lead to dangerous outcomes. I want to make it clear that I'm not discrediting the power of family communication and the fact that I believe all parents need to talk to their teens about safe sex practices. In fact, I think while having these conversations, parents should inform their teens that this confidential care is available to them. Many teens don't even know that this care exists and are afraid of their parents finding out. In conclusion, it is important for the laws to remain the same and teens to continue to have access to completely confidential care when obtaining reproductive health services. Preventing teens from getting this care unless they involve a parent is a direct violation of a teen's rights. I will leave you today with some unsettling facts that I hope get you thinking about the topic and perhaps help you to find the courage to sit down and have a conversation with your teenager when the time comes. Over half of all new HIV infections in the United States occur in adolescence. Every year, 3 million U.S. teens contract an STD. Teenage girls have the highest reported rates of chlamydia and gonorrhea, And lastly, in a single act of unprotected sex with an infected partner, a teenage girl has a 1% risk of acquiring HIV, a 30% risk of getting genital herpes, and a 50% chance of contracting gonorrhea.